Welcome to the channel and welcome to Abcde assessment in short. In short videos are quick summaries of concepts and their application to nursing. Abcde is a patient assessment tool. It's a mnemonic, with each letter prompting a set of observations. It stands for airway, breathing, circulation, disability, and exposure. To fulfill the potential of the tool, there are some user instructions. A, B, C, D, and E come in that order. They need to be assessed in sequence. This is because the complications that may be identified by each letter start with the most urgent and life-threatening and get successively less so. For example, if your patient's airway is obstructed, it is more urgent and life-threatening than if they are hypoglycemic. Therefore, the second rule to apply during assessment is that once you have identified any urgent care need, intervene and stabilize the condition before moving on to the next letter of assessment. If, for example, whilst assessing circulation, the patient is significantly hypotensive, reposition, consider oral and IV fluid challenges and drug therapies where appropriate, then monitor the effect of treatments and ensure that the patient is cardiovascularly stable before moving on with assessment. This promotion of early intervention during assessment is proven to improve patient outcomes and is one of the reasons that the tool is so popular in acute and critical care. Rinse and repeat regularly and accompanying any therapy or treatment. Patient condition may change quickly, and a wide scope assessment catches systemic early warning signs and can prevent deterioration and improve prognosis. The strength of the Abcde assessment model is well evidenced in nursing and medical research. Its prioritization of critical needs in assessment and treatment guides clinical decision-making and care. The systematic process of the model ensures assessment is thorough and comprehensive. The systemic scope of a comprehensive assessment and the prioritized order of the Abcde assessment is particularly effective identifying emergency needs. The methodical grouping of assessments helps clear relay of patient information between healthcare professionals, and it helps that the tool is widely taught to nurses and other members of the multidisciplinary team. It's also important to understand the weaknesses of your assessment tool and compensate for them where you can. Abcde only focuses on physical health and well-being. To mitigate this, consider an additional assessment model that ensures holistic health needs are noted and met. The assessment model is also non-specific to healthcare setting or patient group. This obviously enables the widespread use of the tool, but isn't as great at prompting specialized care. This is where care pathways, procedural protocols, and other checklists come in useful, so it's worth considering if any are applicable to your patient. The practical skills video walks through the application of the Abcde approach, but here's an overview. In A, we assess the patency of the airway. Only if the airway is patent do you continue to B. B stands for breathing and is concerned with the rest of the respiratory system. Observations include respiration rate, rhythm and depth, as well as bilateral expansion and the presence of sounds or secretions. C is for circulation. You measure the temperature, heart rate, blood pressure, capillary refill time, and calculate fluid balance. In circulation, you're assessing perfusion, so it is important to look for signs such as discoloration or peripheral coldness, as well as cardiovascular and hemodynamic stability. D is for disability and explores the patient's level of consciousness. It should be measured with a scale such as AVPU or a Glasgow Coma score, depending on acuity. The assessment should also consider the patient's pain, level of sedation, and especially if diabetic, the patient's blood glucose levels. E is an instruction, exposure. Taking care to protect patient dignity and reduce heat loss, the patient should be completely exposed and examined from head to toe to check for signs of trauma, bleeding, bruising, and other visible irregularities. It is also useful to touch the skin to check for tenderness and temperature. If you have any further questions on the Abcde assessment, please let me know in the comments below. Thanks for watching, and please give us a like if you enjoyed yourself. Subscribe for more nursing videos. Bye!